So call to order the special called council meeting for August 23rd, 2021. We have one item on the agenda, discussion and possible action on a local state of emergency related to public health and safety. I think you all have a drafted emergency ordinance authorizing to grant authority to mayor and or city manager to establish policies and to establish meeting procedures during state of public health emergency. So want to discuss that? Mr. Dyer, do you want to? Yes. I know we talked about this, was this necessary, or would you explain?
In March of 2020, you'll recall, this is the ordinance we adopted. It said all meetings shall be virtual and all that. So the revision I made from then till now is just making it possible. So you're not saying it has to be done, but you're authorizing the mayor for any meeting in the city, so that would include city council meetings, the city manager for meetings involving staff, and any committee chairpersons for committee meetings can decide to make it a virtual meeting. And then the mayor or the city manager has authority to enact rules for employees and for the building, which is the exact same language we did in March 2020.
Okay.
So none of this is mandating anything. It's just so we don't have to come back if you decided to do it.
To do things down the road. So
it would just give the authority. And all of that is because of the open meetings law, which they changed in 2021 to provide that one of the emergency conditions can be a local declaration of emergency. So that was a change to the law. So even if the state has not declared emergency, we can, which would allow us to go to virtual meetings if you wanted to.
Right.
But we have to have the ordinance to be able to do that.
Just discussing city policies, correct? So I believe, well, if I'm not incorrect, I think council members' wishes were to discuss required masks on city facilities. Is that correct?
Right.
Someone like to?
I'm sorry. What did you say, Bill?
I believe the issue was up for discussion about requiring masks in city facilities. Is that correct?
That's
discussion.
Yeah, I think the issue we've got is that we have hospitals that have ICU beds that are filling up. It's a crisis across the state. We're back to where we were towards the peak during the last run. Vaccination numbers are coming up, and that's good. But we still have a lot of our residents that are getting sick. They're still going to the hospital. And even when they're in the hospital, taking up emergency room space, somebody who doesn't have a COVID-related injury or illness, they're having trouble getting into different hospitals. We saw Kennestone's talk last week about their crisis there. Reports from inside Northside are that things are not peachy there either. The governor, I think, has constrained us to some extent on what we can and cannot do, but for what we have agency over, I think we should exercise that agency. If we can help keep, people don't always have a choice to come into City Hall. So they have to come into City Hall for different reasons and have different needs. It's not something they can just avoid if they don't like a restaurant downtown where they just don't go there. City Hall's not that place. Similar to what we see with the courts. People have to come to the courts. Courts have already done the same thing here in town. I think it's good for us to follow that and at a minimum have masks here in city buildings. Encourage social distancing. I think we could certainly make a statement to encourage businesses, not mandate businesses, but to encourage businesses to keep people safe and provide those resources and be those leaders. It fits the roadmap for leading with excellence as well.
Mm-hmm. Yes. Yes.
There you go.
Other discussion.
I agree. I believe I saw stats this morning that of all the Metro Atlanta schools, we also have the highest rate in our schools. So I think anything we can do to mitigate that, and it seems right now that the thing that we can do is to say, for 30 days we're going to require masks in city buildings and then reevaluate and pass this emergency ordinance.
Okay.
If I may add to that, this is similar to last year, but worse, and in the sense that this is a much more contagious virus. It's playing out as the experts predicted it might, unfortunately. So totally, fully support it, and if we need to go beyond that, I would be on board with that as well.
Ms. Wilson?
I think this would also come under the emergency policy that we're looking at, so that's why I want to bring it up now. I think if we're going to be a model for everyone else and require masks be worn in City Hall, that we should also require all employees, unless they have a doctor's waiver, must be vaccinated to work here. We are never going to get rid of the virus by wearing masks. We're only going to get rid of it if we are vaccinated. So I think that we should also require our city employees to be vaccinated.
Okay. Mr. Dyer, Mr. Peppers, are there any discussion on that? Or Ms. McGree, while they're
I was going to say, while they confer, I would like to throw in my support of masks in city buildings. It's the very least we can do to mitigate the circumstances that we're going through. I wish we could actually do more, but apparently we cannot. Ms. Wilson, I'm not opposed to vaccinations for our employees. I don't oppose that at all. I'm sure Mr. Dyer and Mr. Peppers will have to hash that out for us. I was alarmed when I saw the news and read an article the other day that Canton Hospital has ordered mobile morgues and their numbers. And I'd like to do everything that we can that Northside Cherokee doesn't reach that point and that we don't lose more of our neighbors.
Okay. Yes. Mr. Peppers.
I was just going to say, one of the things that there's this big conversation going on with local government, how you're dealing with employees as it relates to time off, should they become a positive case. And what several communities have done as it relates specifically to vaccination is not require vaccination, but if you are a vaccinated employee and you do become positive, the city is covering your cost of time off. If you're a non-vaccinated employee that's positive, you have to use your own time. So it's encouraging people to get the vaccination, not requiring them to do that. Does that make sense?
Why would we not require them if we're going to require them to wear a mask? If we mandate a mask, why can't we mandate you have to have the vaccination? You have to have a smallpox vaccination and many others to go to school.
You actually don't.
The issue we get into is there are certain vaccinations that are federally required. There are certain vaccinations that are required at the state level from public health. This one currently is not.
Right, and neither is wearing a mask.
I understand that. What I'm saying is if we were going to go with that additional policy, I would want the opportunity to sit down with law attorneys to make sure we're not public body employer. I know private sector employers have some leeway as it relates to that. I don't know if the public sector has that same leeway. So that would be something.
Okay, so your alternative is that if an employee gets vaccinated and has to take time off from work, that we would cover that time off from work. If they do not want to get vaccinated and they get sick, we don't cover their time off, except for their sick policy.
That's just an example of what's out there. I think what I would want to do is if it's the direction of council that y'all want employees to be vaccinated, to be able to have the conversation with our employment law attorney first. And if that's fine, if there's not any, if there's existing, examples of that or challenges that have been upheld, I don't have a problem requiring that.
I'll accept that, but I also would like to, could we consider that masks are not mandatory, but they are highly encouraged, and that gives our people at least some option. They're going to be having to sit in here all day in a mask.
Well,
That's not how it was last time.
what we did the last time is we had a mask recommendation for our facilities. We didn't get into individuals walking in that might have a health issue or religious issue or anything like that. We had signs on the doors that said that masks are recommended for all individuals in the facility. We made sure that our employees had masks And if they were not in a room where they could be distanced from someone, they were told to wear their mask. If they were out in the hallways, or if they were in break rooms, or if there were meetings on site, they were asked to wear their masks. In most cases, when people came into City Hall and they were conducting business here, they wore a mask. There was a rare exception that somebody might come in without a mask. Council meetings are a little bit different in that, we, again, told people we recommended masks, but we didn't go up to individuals and ask about health concerns and things like that. So that's the only thing I would note. If y'all want a full-on mandate, then our employees will need to wear a mask all day long.
Yeah, I don't think that anyone on council brought forward a full-on mandate asking employees to wear masks all day long, and that's not even what we did last year.
Yeah, and I think what we did
Mr. Tolan, I wasn't quite finished.
Oh, go ahead.
Thank you. Also, I fully support incentivizing vaccines if city staff is interested in that or council is interested in that. I believe that the point of passing this emergency ordinance as it was last time, except giving us more options for meetings, is to show the public that we give a damn about what's happening out there and nothing more or less. It's not a power play. It's not about politics. It's about that our school system has the highest rate of COVID in Metro Atlanta, that our hospitals are filling up, that mobile morgues are being brought in, and that as leaders in this city, we would like to show that we're trying to do something about it.
That's why I wanted us to have vaccinations mandatory,
Well-
so that we're leaders in the city, and we're not going to get rid of the virus until everyone is vaccinated, or at least we have herd immunity. That's why I want us to be that kind of leader.
Well, I understand what you're saying, Ms. Wilson, but I am not going to get on board with mandatory vaccination.
Tell me why you're against it.
Well, I would be glad to tell you that off record about my family experience. And I am fully vaccinated. And I am all for incentivizing it for our employees, but I am not for making it mandatory.
Are those not the reasons that someone could say they don't want to wear a mask also?
Perhaps they could. But what I'm here to tell you as Brooke Schmidt, the city council person, is that I would like our city manager to do what he just said, which is what we did last time, which is not mandating a mask. It's exactly what Mr. Peppers just said.
Well, I'll go along with what you said, if I understand it correctly, that if there's at least 3 feet space between people, they will not have to wear a mask, right? Is that what we're going to be requiring? I want to be sure I know what I'm voting on.
What we did the last time is we started throttling down meetings in City Hall. So non-necessary meetings, council meetings, I would consider that to be a necessary meeting. But we encouraged our staff, when they could meet virtually with folks from the outside, to do that. We encouraged our staff to use our larger spaces for meetings. That way, if we did have a meeting, we could spread people out. In areas where we have multiple employees that are working at the same time in the same location, we ask them to wear a mask. Where employees are together in a hallway or a break room, we ask them to wear a mask. If they're in their own individual office by themselves, we did not ask them to wear a mask.
Okay, I'll concur to that.
Thanks, Ms. Wilson.
But nobody's going to concur to the mandatory vaccinations. I see it around the room.
Well, I'll say I think I'm interested in talking more about it. I like the idea of doing incentivizing, encouraging, even mandating. That doesn't necessarily give me a lot of heartburn, but
Right.
I want to get back. I would like to hear back from the
Right.
attorneys and some more ideas.
Right. So are we also going to have in our vote that what you were talking about, that if an employee is vaccinated and has to be out because of the vaccination, we will cover them, right?
I take it from council that you want us to look at ways to incentivize staff being vaccinated.
Right.
I would feel
Encourage
I
them.
would feel comfortable coming back to you in 2 weeks with some options on
Okay.
encouraging vaccination of staff.
Okay, I'll go along with that too.
I think that's the goal, is to offer as much encouragement as possible. Again, and checking into, what the options are and what the best practices of other cities, as Mr. Carlin said, leading with excellence. I I don't think I could get on board with fully mandating vaccines for city employees. We don't mandate flu shots and things of that nature. I mean, I think wearing a mask is one thing, an accessory versus, something you're doing to your body. And again, I would wish they all would, but I mean, I was at a local business this morning and they were very, very, very shorthanded because of the second outbreak, it impacting their younger staff. It didn't impact them the first go around, but over half of their younger staff were out this morning. So it is an issue, and I think in caring for our employees and caring for our citizens that come into our facilities, I think that is the primary thing. At least we should start with, and again, seeing what happens, and we can adjust like we did last time. I think we probably changed policies sometimes, a couple times a day, but I think we should all keep our minds open to what we need to do. If things get worse, and I hope they get better. So, but I applaud you, Ms. Wilson, for taking a strong stance on it.
I'm just feel like we're never going to get rid of it till people.
I agree.
I mean, we didn't get rid of polio till people got vaccinated.
I couldn't agree. I couldn't agree more with you personally. I admire you for taking that stance.
As of today, the third shot is now available for everybody.
Yes, and I'm going to get it. So, Mr. Tolan.
Yeah. Before I so rudely interrupted Ms. Schmidt, what I was going to say
Excuse me.
is I think last time around, Mr. Peppers, we did offer masks to the public if they came in without one. I'm assuming we're going to continue doing that.
We will.
And then I wanted it to go on record that I fully support this notion of offering time off for folks that are vaccinated that do come down with the virus and reverting to regular PTO for those that aren't vaccinated.
So again, I think the goal there or our asks there is to ask Mr. Peppers to come back within 2 weeks with a policy that would strongly encourage our employees to be vaccinated.
I'd like to, I don't think we said this explicitly, but I mean, that's not just time off policy, but if I know there have been cities that have done, monetary incentives, any sort of, like all options on the table as y'all are looking at it.
I think a good example of that, Moultrie, Georgia, I was reading, their community as a whole is only about 39% vaccinated, but they provided a financial incentive to employees to either get vaccinated or to employees that were already vaccinated. I want to say it was 500 or 1,000. I can't remember what it was, but at the time, they were already up to like 70% of their staff being vaccinated. So they were able to, and they used ARPA funds for it, so they were able to go back to true data to show that there was a benefit to the employee. At the same time, you're going to have cases where you have vaccinated employees who do get sick, and they've done everything that they can within their power to try to, protect themselves and protect their family, but they also work with the public every day.
So you're going to bring us options for that?
Yes, ma'am.
As far as what we need to do today, I think today is a emergency order here, and then Mr. Peppers has some direction. The mayor, you have some direction, I think, as well, kind of and committee chairs have directions to where we're going.
Yes, if I understand this correctly, if we approve this emergency order today, that authorize Mr. Peppers to establish the same mask policies we've had in facilities before. That's what we're asking him to do. And then we can adjust, again, if things get worse, we can adjust. I mean, I think last time I didn't take any executive powers without consulting with council.
That was the point I was going to make. This order is actually allowing the mayor or the city manager to do these things, but they're telling you they're going to come back and make sure it's something you want to do.
Exactly.
So you're not
But if we
actually
approve this
voting
today,
for
that would
anybody.
allow Mr. Peppers to enact the same policies that he did before in city facilities. Indoors, I'm assuming that we're talking about. So it's not like our public works outdoors. We're asking them to wear masks. So.
And then for committee meetings, this allows the chairs to decide if they can have the auditorium space and it's spread out like this and there's 7 people having a meeting and they're wearing masks, it's not a big deal to have an in-person meeting. So
the only concern I have with that, and I think I would need to poll committee by committee.
Okay,
We don't want a situation where you've got a split committee and you've got half that want to meet in person and half that want to meet virtually, because that becomes a little unwieldy as it relates to the, to the meetings.
okay,
So we will work directly with the committee chairs to find out how each committee feels, and if they want to meet virtually, we'll set it up virtually. If they want to meet in person, we'll work to set it up in person.
okay.
At some point, though, depending on what's going on in the community, I would just suggest to council that, the city manager have the opportunity to say, no, that's not an appropriate meeting, or that's not an appropriate way to set that up at this time, which is what we were basically doing before.
Yeah. This
So
order
we
would-
can reevaluate at any time.
I'll have to admit, when I drafted this, I was thinking city council committees. I wasn't
Oh.
thinking about all the other committees.
Sorry.
Obviously, the mayor would have the power to correct that. So we could amend that to just say city council committee chairman for the committees that you have, and let the city manager be in charge, or the mayor in charge of other committees that involve citizens. So that's
I think
what
that makes sense.
Okay,
And we do have some boards and commissions that, that hold public open meetings that, again, I think last time, we don't want there to be any confusion with the public too, whether a meeting is happening and, should they attend in public or online too. So I think maybe just drafting some best practices there.
And the law changed this year, was clear about public hearings. It's okay to do public hearings as long as the public has a meaningful way to vote. That was uncertain until they changed the law.
I think that's, if we want to consider that, though, I think that we need to have enough, lead time to make sure everyone's aware of that and public's aware of those, that if those do change from in-person meetings. So, but I think today, unless someone corrects me wrong, I think the mask policy and in city facilities was the main topic of order.
Yes.
Okay.
so I'll move to approve this emergency ordinance with an amendment to number 4, any city council committee chairperson.
We have a motion
Second.
and a second. Any further discussion? All members in favor say aye.
Aye.
Opposed, say no. All members voted for the motion. And I will entertain a motion to adjourn.
Motion to adjourn.
A motion and a second. All in favor say aye.
Aye.
Opposed, nay. Special session is adjourned.